Today, the U.S. Surgeon General is warning Americans alcohol consumption can increase the risk of certain cancers. Health experts have long linked alcohol consumption to other health problems like high blood pressure and weight gain. And some people have already started their journey to limit their alcohol intake this month. Reporter Lauren Davis shares the two sides to Dry January.
Dr. Patrick Jensen at Covenant Health says there are health benefits to Dry January.
A lot of these folks can lose weight whenever they reduce or eliminate their drinking. Alcohol is a risk factor for high blood pressure, and so their blood pressure may normalize over the course of January.
He says alcohol is known to cause certain health issues, so medical professionals will always advise limiting your intake.
Looking at increased cardiovascular risk, hepatic risk, cirrhosis of the liver, any kind of cancer-like syndromes, and of course dementia, like I mentioned before.
Zach Roskopf, the owner and operator of Knox Brew Hub, says he noticed lower sales during the month of January.
It's actually one of the reasons why we added a kitchen, was so the food could help us get through months like January.
He says fewer people drinking this month also creates challenges for his employees.
They so heavily rely on tips, and tips require customers to come through the door.
He suggests drinking non-alcoholic beverages or taking your 31 days of sobriety for January and spreading them throughout the year.
I made the joke that instead of taking off the whole month of January, pick, a few weekends a year to spread it out. I think that moderation is a key to a healthy lifestyle when it comes to consuming alcohol.
And Dr. Jensen says there's nothing wrong with limiting your drinking throughout the year.
Any efforts to reduce the amount of problematic drinking or above recommended limits of drinking will be helpful.